fact that when the task force was over, and now presently, the task force was commissioned to put together all the findings of what we as a state would recommend if there was going to be continuing any legislation and mandates around cervical cancer, HPV, and what our agenda would be. And when that finally came into final fruition, we put our findings first. Legislation, some happened, some didn't. But still, without legislation, a lot happened for the state, which just really goes to show that a lot of movement can happen, and it doesn't actually have to become a mandated bill and legislation to actually change policy, which is, really a great American process. And Vermont was a great example of that. But we then all sat around the table and thought, well, who's going to watch this? Like, we're all going to disband, and then there's going to be legislation, and no one's going to really see if this happens. And we all volunteered, so we created a volunteer roundtable called the Cervical Cancer Work Group. It wasn't technically a task force anymore, and that is still in play, and we have set up a bunch of priorities and objectives. Being that it's a roundtable, we have all sorts of partners with us. I mean, that includes, we have Planned Parenthood, we have Ladies First, is what we call with our the CDC program that we were hearing about earlier. Our state is called Ladies First. So they're at the table as well. As we have insurers, we have private insurers, we have someone there from Medicaid, Blue Cross Blue Shield, Cigna. We also have oncologists, doctors, legislators, survivor, Vermont Department of Health, vaccine experts. So everyone has still stepped up and been part of this roundtable. And the great part of this is that now we've been able to move forward, and we've set up our priorities, which are for the state's objective in following this legislation is to really follow the state's Vermont Department of Health, cancer control and prevention program. So we're looking at trying to eliminate and lower the morbidity and cervical cancer rates in the state of Vermont by 2015 in the cancer prevention and cancer control objectives. And how we're going to do that is through HPV awareness and immunization, as well as screenings for low-income, un- and underinsured women. So one of the ways that we do that is through the Hicks Foundation, which is a nonprofit that I started. The state has started to work with nonprofit, which sounds pretty amazing. I mean, I'm psyched. Clearly, I started this program, but it's also really amazing to have a state agency and many at this roundtable start recognizing grassroots organizations that want to do work and have a lot more access to doing things because they don't have the barriers of political policy, which is a lot of times what happens when some people can't show up at the table to talk about something because they are part of an agency. And I have the wonderful freedom of having, full free speech to talk about an issue. And so one of the ways we do this is we do free medical screening and breaking down barriers of access to care. So Vermont has an agricultural state, so we try to address migrant and immigrant workers. We do that by working with rural task force, rural groups, and then we set up screening days with translators and trying to break down any other barriers, which would be providing incentives and money, $10 gas cards, providing food, child care, being open on Saturdays, anything that would sort of alleviate those barriers that we talked about earlier of reasons why people don't show up for screening, but also to make sure that every time that they come, they're then going to be provided with a medical home, and that's our goal with Hicks too, and overall the state, but that we will have there, part of our roundtable is to have present at all of these screenings is to have the CDC program person there as well as a state program person there who will physically do these applications, because as we were just saying applications are hard for a lot of these demographics, and so if we can finish all that paperwork by the end of this screening, they've not only been screened, whatever the outcome is, they will have a medical provider in home so that they can get follow-up care, and it will all be covered. And ideally, they can move on and have a better wellness. So the state is doing a great job with that. We're working with Hicks that way too. We also do education around HPV, the vaccine, which Denise can talk again about, is the legislation that led to how the vaccine has really become greatly provided for Vermont.
So as we said, the cervical cancer task force came to an end. So then what we did is it published a report, went to all 180 legislators. But something else wonderful happened out of that as well. Vermont annually publishes it's called Healthy Vermonters, and whatever the year is, it has the date on it. Never before had there been a page on cervical cancer. Now if you Google Department of Health, Healthy Vermonters, you can find the current statistics on the women. It's 2 pages. They have 2